on share now, Poppy. We're now live, Nazarene.
Okay, great. Hello, everyone, and welcome to this IDS webinar on mobilizing knowledge in emergencies with care and intent. If you're wondering what we mean by this title, stay tuned to hear from a diverse group of research organizations who will share their stories of how the evidence community responded to the COVID-19 crisis in their countries. My name is Nasreen Jassani, and I have the honor of chairing this webinar today. Before we get to the exciting parts, I'd like to ensure that you're all comfortable before we proceed. I would therefore like to remind you that there is simultaneous translation in Spanish, French, and English. So if you'd like to be hearing this in another language, then please do click on the world globe sign at the bottom of your screen on the Zoom, and you'll be able to access the language of your choice. If you're having any challenges, please drop a note in the chat and someone will assist you. I'd also like to draw your attention to the question and answer button at the bottom of your Zoom screen. So you'll see a chat button and a Q&A button. So if you have any content-related questions to the panelists, please use the Q&A button, and they will do their best to respond to you in that box. But we'll also try to get to as many questions as possible during the discussion session. So without further ado, I'd like to provide you just a little bit of background before we launch into the discussion. This webinar may be celebrating the launch of a special issue bulletin, but what is more interesting is the stories that will be shared. These stories come from a program called the COVID-19 Responses for Equity Program, CORE, which was supported by the International Development Research Center, also known as IDRC in Canada. I have the pleasure of being joined today by 4 of the contributing authors from across the globe who will discuss key aspects of Southern Research Institute's ability to respond to the COVID-19 pandemic. And we'll try to unpack what lessons can be learned about research leadership in emergencies and the implications for research funding, equitable partnerships, and crisis preparedness and response. You might want to explore other ideas, so do keep these handy for the Q&A period. I'd like to begin, however, by inviting Andrea Ordonez and James Georgilakis, the editors of the special issue of the IDS Bulletin, to provide some opening remarks. And while they're turning their videos on, I'll give you a little bit of background on each of them. Andrea Ordonez is the executive director of Southern Voice, and this is a network of over 60 think tanks from around the world. Andrea is an economist by training, and she was previously research director at Grupo Faro, a think tank in Ecuador. James Georgilakis is the Director of Evidence and Impact at the Institute of Development Studies. He leads the Core Knowledge Translation Project and FCDO's Knowledge for Development and Diplomacy program. Andrea and James, a very warm welcome to the both of you. I'll hand over the mic to you to provide us with a small taste of the history of the Core program. Thank you.
Thanks so much, Nazreen. So I'm just going to kick things off with a little bit of background on the issue, how it came about, because I think that's all part of the story. And then I'll hand over to Andrea, who will talk a bit more about what we've really discovered from this process. So firstly, I should explain that the IDS Bulletin is a gold open access journal, peer-reviewed journal, and every issue of the IDS Bulletin is a special issue. So every issue has a topic. And we quite often utilize the journal to tell the story of a particular network of researchers or a particular program. And there's a strong emphasis on inviting people in as guest editors. The journal, we believe, has the highest proportion of Southern authors of any journal focused on aspects of development studies. And every issue is very much a collaboration. It's kind of a co-production, co-development of the concept for the issue and co-production of the content. And so the core program, which IDS has been supporting, COVID-19 Responses for Equity, felt like a perfect opportunity to commission an issue of the bulletin. This was 3 years, a 3-year investment by IDRC, as Nazreen's already explained, that funded 20 projects spanning 42 countries, and was mobilized extremely rapidly to ensure that there was Southern-led research taking place to help understand the socio-economic impacts of the pandemic, improve responses in specific country contexts, but also to generate longer-term learning. And this cohort of researchers, some of whom you're going to meet today, was very much built out of some longer-term partnerships that had existed between IDRC and its research partners in the Global South. And IDS was brought in to support the cohort, to support the program as a whole, to try and help maximize the learning generated across the program, and to really think about how we could help the individual projects kind of add up to more than the sum of their parts. And this has involved a lot of evidence synthesis across different projects, the co-facilitation of various learning events or policy engagement in global forums, and the documenting of stories of change emerging from the specific projects. And if you're interested in the program as a whole, you can still visit the core website, and perhaps one of my colleagues could post the URL link into the chat now for that. It's very rich. So we recognized that there was a fantastic opportunity as we came towards the end of this program to document the learning around this actual mechanism of rapidly responding to emergencies. So, the projects themselves and the lead organizations and their downstream partners have done a fantastic job of documenting their own learning in their particular projects, but we were very keen to give them a platform through which we could explore this mechanism. And so we put out a closed call to the whole cohort, in which we asked for reflections from the research teams around this integration of rapid action orientated research into policy and practice during the pandemic. And we got some fantastic responses, and we've been able to publish 8 papers, and there's a list here on the slide of all the contributions. I think it's notable to say that this is a special issue where every author is from the Global South, apart from me. I'm the only person involved in the production of it and the writing of it who's in the North. It's geographically extremely diverse. It's one of the most heavily translated issues we've ever produced at IDS, because we felt it was very important to offer authors the opportunity to submit in whichever language they wanted to write in. They don't have to write in English. And then to translate content that was focused on particular regions into the appropriate language where possible. So this is about accessibility. It's about breaking down some of those traditional barriers that exist for journal publication for Southern researchers, given this is a story about the success of Southern research leadership. So do check out the issue after this event, and I'm going to hand over to Andrea to talk about what we actually fathomed from looking across these very diverse case studies. Thank you.
Thank you, James, and sorry, thanks for to IDS for inviting me to join in the production of these bulletin. It was a very interesting experience, particularly because I think there's a lot to learn from the organizations that were involved in this process. And I'm going to briefly go through kind of like the buckets of ideas that we were interested in exploring more in depth, so that in the panel following the presentation, you can get to listen more of the experts at carrying this change forward during the COVID crisis. So the first kind of like big bucket of ideas that we wanted to explore were around the institutional readiness for implementing research in the times of COVID. And the reason why we wanted to take these lenses was to not have a project only lens to the work. We know that in development we tend to work in this project and these project cycles that end up guiding a lot of our work, but we know that the success or not of them depend not only on the structure of how the program or the project is planned, but where it sits, what is the institution where it sits. And that's where we asked our colleagues to reflect on how was it that their institutions, the capacities, the background that the institutions had allowed them to respond to their context. And it comes through in all the various case studies that indeed this institutional readiness is critical. An institution needs this kind of like historical CV of experience, of networks, of capacity, but then they also need the ability to be able to quickly take on all these assets that institutions have and mobilize them when the opportunities arise. So I think here the main thing in the back of our mind was to look beyond the projects. And we know, like I was mentioning earlier, that we work through projects, but the success of the activities, of the actions that we implement go much more beyond than the project. And this is where the institutions that are where these projects are embedded become critical. So that's the first bucket. We can go to the second slide. The second question we wanted to explore was how do we understand and how organizations go about identifying what is the knowledge that would be fit for purpose to respond to a crisis like COVID. So we wanted to look into understanding, there are many different methodologies, there are many different approaches that projects and research teams were taking forward. But what were some of the commonalities about how to make this knowledge relevant for these particular crises and to respond to events such as COVID and others that may come in the future. And what we discovered in the process was that really in all of the approaches, the methodologies used, there was clear emphasis on having processes to gather inputs, insights into the research process. So none of the research teams stayed with a very static understanding of their research and how these would, support change, but they were willing to adapt and take forward ideas, suggestions from the wider community that they were working in order to have an impact. They were willing to adapt also in terms of the their approach to the research itself. And one important thing that we also saw across the case studies was this importance of what we started calling this hyper-local knowledge. We see that there was a lot of emphasis on very specific, very context-specific research and knowledge during the pandemic, and how these organizations were very well positioned to actually develop these type of knowledge and to challenge, in many cases, some strong held beliefs from pre-existing knowledge that was done in other settings, but that researchers felt was not necessarily useful or applicable in their particular context. And then the third bucket that we were wanting to explore was how organizations were doing the work of translating the research, their capacity, their intellectual capacities, and so on, into actual change. This is where we identified that organizations were really embedding the objective of change and of working with actors from very early on, as I was saying before. So this is the use of the evidence, of the knowledge that was being produced in the projects was not left as an afterthought to the research process, but it was really part of all these initiatives. I was very embedded in the engagement was a part of the research process itself. But we know that we were doing this work in a time of crisis, in a time where for many people probably research was not the top of the agenda, where we were all experiencing an individual crisis during COVID as well. And we saw many approaches that were taken throughout the projects that were taking this into consideration and adding this lens of care and respect to the process. So there was a very strong emphasis in a lot of the initiatives to make sure that this research was taking these into consideration, taking into consideration the crisis that, for example, workers that were losing their job were having. And so it's not only research for them, right? It's them losing their livelihood opportunities. We saw also that these processes required a lot of flexibility and agility, a lot of willingness, again, to adapt to the needs of a variety of stakeholders that the research teams in the case studies were working with. So these are just the general themes that we were exploring in the bulletin. The stories and the case studies are all very rich and from very different contexts, and as has been previously mentioned. So I think in the next part of the panel, it'll be great to for you to all get more in-depth exposure to some of these case studies and the specific work carried forward. It was indeed really a very enriching experience to learn from all these case studies. Thanks.
Super. Thank you so much, James and Andrea, for that background, but also for explaining how all the lovely experiences from across the countries have been threaded together to kind of find some similarities about what are the enablers and what are the disruptors that allowed for some of these responses to occur. And I'm looking forward now for us to kind of deep dive into at least 4 of these experiences with our esteemed panelists. So if I could ask our colleagues to turn on their videos while I introduce you to our participants, that would be great. So joining us today are Ana Carolina Ogando, who is a research coordinator at Women in Informal Employment, Globalizing and Organizing, WEGO. Since joining WEGO in 2012, she has worked closely with waste pickers in Belo Horizonte, Brazil, on capacity building for membership-based organizations centered on raising gender awareness and occupational health and safety. Ana Carolina will share key aspects of their project with the informal economy, the role of research activists, and the multidimensional impact of COVID-19 on worker livelihoods. Our next panelist is Ramos Mabugu, and he's a professor in economics and also a research fellow at the Global Research Network Partnership for Economic Policy, PEP, at Laval University in Canada and Stellenbosch University in South Africa. Ramos will share PEP's experiences with state actors with respect to the role of risk-based economic modeling to estimate socioeconomic impacts of the COVID-19 pandemic in Zimbabwe. Our third panelist is Helani Galpaya, and she is the CEO of Learn Asia in Sri Lanka, a pro-poor, pro-market think tank working on digital and infrastructure policy issues across the Asia Pacific. She engages in public discourse on policy issues related to digitalization and development. Helani shares Sri Lanka's response to a polycrisis, whereby there was a global pandemic coupled with a national economic crisis in the country. The effects on the education sector, on digital commerce, and other aspects of the social fabric were central to their research. And last but not least, we're joined by Matthias Bianchi, who is the director of Asuntos del Sur, an Argentina-based think and do tank that fosters more inclusive, equal, and democratic societies in Latin America. He coordinates two consortia, Colabora.lat, which designs collaborative governance models for post-pandemic democracies, and SILA, which is Cities in Action, which works to develop civic infrastructure in cities that seek to achieve the MDGs. Matthias will share how such collaborations will leverage to advance a COVID response. Thank you, everyone, for joining us today. As we heard from James, as well as Andrea, that there's a lot of common threads that pull a lot of your stories together. But clearly, the COVID pandemic created opportunities for rapid evidence synthesis by research teams and its use by decision makers. I wonder if I could kick off the discussion by asking you to provide us with a very short background to how your organizations responded and what allowed you to respond to it. So thinking about some of the readiness factors that were mentioned earlier in terms of pre-existing relationships, trust, the understanding of the context, ability to mobilize. What was unique in the readiness of your organizations that allowed you to respond? And so maybe I can start with Ana Carolina in terms of WEGO and how it deployed its resources to work fast in this environment. And I know that in your article, you speak a little bit about non-extractive approaches. Would love to hear you say a little bit more about this. Ana Carolina.
Thank you, Nasreen, and thank you to James and Andrea for the insightful synthesis and the invitation to be here as well. I think this is such an important question for us to be reflecting on together, and a fundamental enabler for WEGO to carry out research with nearly 2,000 workers in informal employment across cities in the global South and North was really its long-standing relationships of trust with membership-based organizations and with local research activist teams across these 11 cities that we worked in. And I would say that it was having this grounded intelligence and connection with worker organizations that allowed WEGO and its partners to quickly map the intelligence and fragilities at the moment, to map the policy context, and particularly to start understanding the multidimensional impacts across different sector groups in these cities. And this intelligence was fundamental to set in motion what I like to think about as a process that was entirely geared towards producing actionable and highly contextualized information so that we would be able to respond to membership-based organizations' needs and demands. And I think a second element of institutional readiness for WEGO was really drawing on lessons from previous research initiatives that were multi-city, multi-sector, and mixed methods. But even drawing from these experiences, there was something very critical about the moment that led us all to carefully think about how are we going to build connection and rapport with workers in a moment of so much loss and fear. And so I think these were two fundamental enablers. It was the relationships of trust and also relying on previous research experiences. But again, working closely with our partners to co-design the process and to co-validate the data that we were finding.
Thank you so much, Carolina. And I think it speaks to that importance of inclusivity and for people to feel that they're part of the solution and not external to research systems. I think that's a really nice explanation of why trust was so critical and those relationships that allowed you to be able to proceed in the way that you did. I'm wondering if I can go next to Helani. Helani, I'm wondering what was it about the institutional readiness that allowed your organization to be able to proceed. And I know that you speak a little bit about relationships that go further into the media as well, and what was the importance of that. Would be really grateful to hear from you on that.
Thank you, Nazreen. I hope I'm clear. If not, just raise your hand and I'll go off screen. I think what Anna Carolina said very much holds true for us. But when it comes to media, LearnAsia has, since its inception for the past 19 or so years, has been very, I would call it media receptive. When a media person calls from the region, including in Sri Lanka, we ask, we respect their deadlines, we share data. We don't say, well, it's under embargo until I write the paper. So there's a history of being very willing to provide data to media. And so there's a long-term relationship of trust and openness to media that has been built up. I think that really helped us because the COVID pandemic was this weird natural experiment where digital, which is what we do, suddenly came into light. And yet our interventions were not in anything digital. It was highlighting how important and therefore how education policy should be structured, how digital is useful in structuring social welfare payments, using digital data to show that the newly proposed changes in social welfare payments are really not pro-poor, that payments limiting it to government banks would really mean people travel 10 kilometers more using big data analysis and call detail records. So one is media trust, and then getting this story out, not as a digital think tank, but talking about how it impacts people with specific examples. I think the second one is really recognizing that in this kind of crisis, existing knowledge what is good enough. We don't have perfect data. We, in fact, used our first interventions from 2 years ago. And we knew it was credible because this had gone through rigorous peer review. And we were open about the fact that the data is initially very old, but let's try and see what we can do with it, I think. Third, possibly for our organization, is multidisciplinarity, I think, became really important. The ability to sort of bring together the social science research, the e-diary methods, when we can't talk to people, using e-diaries and other methods to understand and analyze plates of food in different socioeconomic categories that, among the respondents we were studying, building relationships. So it wasn't just quantitative data crunching. And that required institutional flexibility in contracting, because this is not a straightforward commissioning of a research. There's this iterativeness which contracts are really poor at dealing with. So some of that flexibility came from the administration side. So I would cite those things.
It's really fascinating. Thank you, Alani. And I love the focus on making it very centered on people and people's stories, and really making that the focus of why everything that you were doing was important, and why whatever data was good enough, but we need to move ahead. I'm wondering if I can ask Ramos for you to be able to reflect on the story from your work on the modeling in Zimbabwe, and what allowed that to proceed in that particular context, knowing that the lockdowns were quite harsh there during this time.
Yes. For the case of Zimbabwe, I think what was most unique about organizational readiness to deploy starts from the Partnership for Economic Policy has had a long history of facilitating close collaboration and interaction between policymakers, researchers, and stakeholders in general. And it has over 20 years of experience with doing those kinds of projects, with about 1,400 rigorously trained researchers by PEP, spread in over 60 countries in the global south. So that institutional readiness of PEP meant that it could rapidly deploy a team of researchers to Zimbabwe who were deeply engaged with Zimbabwean issues. Now, the team that was deployed brought with it certain assets onto the table, and I'll touch on the issues of context and relationships that you spoke about. In terms of context, it was very clear that since the new dispensation in Zimbabwe, policymaking had changed. Post-Mugabe era, policymaking became more centralized. So it was centralized decision-making at cabinet level, but with a knack for appreciating evidence in decision-making. So that was a major twist from the previous era in terms of context that we latched onto, that policymaking is at central level, is centralized, but there's a knack for appreciating evidence when undertaking those decisions. And the people or the government officials who inform the principals that sit on cabinet, a lot of them had undertaken long-term investments as researchers. The ones who opened the doors for us into government, many of them were our former students at university. So those long-term relationships that we had invested in helped rapidly open the door into a government, thereby helping us put a foot in. But now the context and the relationships naturally led us to opt for a co-production approach with the state actors. So when we come to discuss the engagement strategy, this is why we opted for a heavily government-embedded collaboration mechanism. It was informed by understanding of the context to policy making and the long-term relationships that we had established to open the door into influencing policy. I would say those are the main points, subtle points from Zimbabwe emphasizing the context as well as the long-term relationships of trust.
Yeah. And this really is the thread that I'm hearing over and over again, is this importance of trust. But it's fascinating to hear about the social network that gets leveraged in times like this, and the social capital, particularly from alumni and students. And I think that's a really powerful kind of anecdote to kind of think about when one thinks about relationships and the ability to influence in situations like this. Matthias, if I can pick up on Ramos's last note on collaboration, I know that this is something that was central to the way that you all approached the work during the pandemic. Could you enlighten us a little bit more about what got you ready, and your organization, in the best position to be able to respond during the pandemic?
Hi, good morning, everybody. Thank you, Nasreen, James, Andrea, and my colleagues for being here. We have a position because the scope of our project was governance, how public policy through collaborative mechanism. So it was already in our setup of the project, in which we had to address it as a research agenda, but also as a challenge to create a group collaborating in research in our consortium. So for us, it was very interesting because we addressed from the very beginning with a realistic point of view on how productive collaboration can be, the outcomes of collaboration, but at the same time to be realistic of the challenges that collaboration, power asymmetries, distances, the pandemic, and all of this was posing on a collaborative research agenda. In our institution, we were born in a way, created, founded in already without a traditional institutional setting. It was always, for many years, we were working online from different places in a network-based setup for our organization. So when we face the challenge of leading this consortium and operating in the pandemic, we were already ready using tools of using the virtual tools, but understanding the fatigue that it creates, or how to implement an integrative approach to collaboration, like Ramirez and Kona propose. But again, with this realistic point of view. So we designed that our board to make the key decision making. We understood that we had to involve our partner institutions from the very beginning in the decision making, from the name of the project, the key decisions on the research agenda, the research exchange from the very beginning. I have to say that the support of IDRC was crucial on this. They allowed us, we need to remember that we submitted a proposal with the very beginning of the pandemic, and we started working 4 or 5 months later when the discussion was different. And the flexibility that the IDRC allowed us was crucial to readjust and to reconnect. In that sense is what we understood in our governance for our research and the governance of the project, that having these levels, different levels of collaboration, even for decision making or research decision making, is crucial. Try to readdress. We understood, for example, at that moment, understood that the production and distribution of vaccines was a crucial topic to understand, that had different layers of decision making that we didn't see that at the beginning. So the decision within the consortium and the collaboration also with IDRC allowed us to readjust and be part. Now we are part of the global network for just distribution of vaccines. That's an example on this kind of collaborative setups when you do the they work. And the question of trust was also important. How we discuss internally the question of trust. And again, I'm sorry if I'm overlapping our research agenda and our work as a consortium, because trust was a crucial point during the pandemic, because even between the research institutions and the government didn't trust on the data, on the reactions, on how to approach. So sharing experiences from different government, from different institutions was also very important. And we also emphasize, and we wrote this in our paper, we learned that leaving some an important degree of autonomy to the members is also very, very important. When we designed the project at the beginning, to give you another example, we said we want to work on if America. And Chile and Argentina, the chapters of Chile and Argentina, our colleagues, they said, look, the level of involvement of local governments in the communities, in the decision-making is crucial. We want to focus on that. And we managed to adapt the project and the agenda to that. And that gave us way better results for the findings of our project. So this is some of the challenges that we face, and we found out that our institutional design allowed us to improve the quality of collaboration.
Thank you. Thanks, Matthias. You went over time a little bit, but it was so interesting. I couldn't interrupt you, and you almost started talking about some of the other topics that I want us to cover. So it's a really nice segue into the next part of the webinar.
I'm sorry.
No, don't be. It's okay. But I think for me, some of the really things that kind of stood out was, that it was important to be inclusive but pragmatic, and I think that's a nice lesson that comes out of this. And I think that's what I'm hearing from some of the other panelists as well, and that having flexibility from the funder, or at least from however something is planned, to allow you to be agile is so important, to be able to be adequately responsive. And I thought that was really nice to hear. You asked a really important question to yourselves, is what do we mean by trust, and trust at what levels? And I wonder if that's a really nice segue for the next part of what I wanted to hear from all of you is, what were your strategies for engagement, and how did you navigate issues of trust and issues of power that inevitably did probably rear their ugly heads, but also that might have shifted over the time of the engagement and during the pandemic. So I'm wondering if, and I know, Ramos, that you had alluded to this as well, so I wonder if I can ask you to come in first, because your article really does highlight the complexities of the pros and cons of those relationships. And if you can elaborate on those power structures and how you navigated those. And then I'll ask the rest of the panelists to also kind of respond from that perspective. So Ramos, over to you.
Yes, thank you. So, as I said, the engagement strategy for Zimbabwe was essentially heavily government embedded, and that was really informed by the fact that COVID response at the national level was being coordinated through a coordinating council that reported to cabinet to take decisions. So we opted for a core modeling strategy with state actors who would participate in the production of the policy recommendations. And in terms of the power dynamics, what was quite fascinating, I think, was we already had built trust over the years with the government officials through doing work for them or supervising them at university. But even in that setup, we would still find them wanting to change certain simulations to suit a certain position. For example, a colleague from agriculture would say, how do we get more funding out of this? And then when you run the simulation, you then be able to show them that in terms of what we said, this is what we want to achieve from the process. This is what happens if you put in more money into agriculture, for example. And another layer that was quite fascinating was how we deal with civil society and the donor community in all this, because we're heavily government embedded and less involved with civil society and donor community. And what's interesting with the Zimbabwean case is that in most instances, you think development researchers interact more with civil society or leverage the donor community in order to get their research into policy. But in our case, it was actually government who brokered our engagement with civil society and donors, partly because it was in their interest to have the work that they are co-producing with also get acceptance with civil society. So it was more
fascinating,
like a coincidence of once that in our case, we wanted to have research contribute to efficient decision-making, while on the policymaker side, they wanted to get acceptability of any of the interventions that they were making. And we call that a coincidence of once in that particular case. So that was the experience from Zimbabwe.
Thank you, Ramos. And tricky situation when you've got evidence trying to be used for political use rather than instrumental use, and how to navigate that, but also the change, the flip in the role of the government that was unexpected. So really interesting to hear that. I'm wondering if maybe I could ask Helani to share a little bit of your engagement strategies, given that you had also a really diverse set of actors and stakeholders in Sri Lanka when you were trying to do this, and you're working across a lot of social sectors. It couldn't have been easy. So would love to hear your reflections on strategies for engagement and obviously the negotiation of power and structures that must have come through that experience. Helani.
Sure. I guess two things. One, I would call sort of finding common ground and showing that there's common ground to multiple powerful people. What I mean by that is, as soon as the huge economic crisis hit and Sri Lanka had to be bailed out by the IMF, which we're currently still in the process. So we transitioned from COVID into this huge, first time ever defaulting on our debt. All the things the huge political parties could not agree on were whether pensions should be cut and state-owned enterprises should be reformed and electricity prices would go up. But we volunteered our time and showed all of them that the one common thing they all agreed on, and this is because of votes, I'm not sure whether this is altruism, the one common thing they agreed on is that the poor people need to be taken care of, right? So we analyzed, showed that social welfare is common ground to all political parties. So that opened a lot of doors and showed that there's common ground, right? So that creates a kind of different power structure when everyone sort of cares about this, or at least politically pretends to care about this. Suddenly the receptiveness to data, anecdotal evidence, as well as systematic evidence increases. I think the second strategy is sort of inside track first and outside is how I would summarize it. What I mean by that is we would, in most instances, tell the bad news to government actors a week, a month before we go public. So in one of our surveys, which showed incredibly poor targeting, we would show it to the Welfare Benefits Board and the World Bank that is in the middle of restructuring a $70 million welfare payment system in the middle of a crisis. And we say, comment on it. Here's the data. We have it on embargo. We say we will have a public event. You're welcome to come and comment on it. Would you sit on it? And give them the time to digest this. We also do the inside track on while we were in the field, the World Bank and the government were in the middle of re-registering beneficiaries, basically canceling previous registrations and saying, if you want anything, you need to re-register. We were going to the poorest economic sectors, which are the estate workers, and finding out large estates with hundreds of workers didn't even know that they needed to re-register. So we quickly, in the middle of the week, call up and say, your communication strategy is not working. So we look like allies, which we are, because we are allies of the poor people. But then we say, look, this is going horribly wrong. So we go public much later. And the time period varies. So the inside first and then go public, I think, is the second strategy that really worked well for us.
Thanks so much, Helani. And that was really succinct. And I think the kind of the main points that I got from that is it's really important to find common values and common ground to kind of unite people. It's a really great unifying factor. And I think the second thing is really not to alienate the people that have the most power and to make sure that they really do feel like you're their allies. So those are great lessons. Thank you so much, Helani. I'm wondering if I can go to Ana Carolina now for your experiences that you could share with us on your strategic engagement.
Sure. I think I'm also going to try to weave in some of the elements of how the research wasn't extractive. And hopefully that touches upon your question of power and then getting to strategies of engagement. And the reason I want to foreground this is because research processes at WeGo are never an end in and of themselves. And we really do see research as both a capacity building tool, but also a mobilizing tool for action. And the intent here is that the action will lead to more inclusive claims-making processes for worker organizations and their leaders. And despite the fact that we were challenged by physical and social distancing, WeGo's research teams really carried out the research with care, the deep listening and active involvement throughout all stages of the pandemic and not just one given moment in time. And so the research itself wasn't designed to extract information and then disseminate it on behalf of the workers, but rather it was designed with and for the workers so that we could make visible their policy demands. And this kind of engagement is relevant for us to talk about as well, because it embodies a sense of interconnectedness for everyone involved in the research and allows us then to collectively and continuously strategize on the spaces that we're finding to leverage power with the worker organizations. And I think that was a continuous conversation, and we were very much guided by our local teams stating what those leverage points were and how best we could respond to that in terms of multiple outputs that we were disseminating together, or just responding very quickly to support the worker organizations, whether it was at the local, national, or even global advocacy spaces. So I think that is part of the picture in terms of looking at power dynamics and how you co-produce knowledge that is relevant and actionable.
I love that, Ana Carolina, and I've got a big heart on my piece of paper here that says research is a capacity building tool, but also a tool for action. I love that in terms of evidence use. And Matthias, I'm bringing you in now because you've always got fantastic things to be able to share in terms of your thinking with respect to power dynamics, as you were talking about trust, and wondering if you want to share a little bit about your strategies for engagement.
I'm sorry, I was on mute. The consortium with the members, for us was crucial the autonomy that we provide and the support for that autonomy that I already mentioned that helped them to adapt. So the creation of that kind of incentives. Another important strategy that we use is we were very careful with the use of time. We want them to understand that us as leading in this research strategy, we were very careful trying to add value to the research instead of creating more points of interactions. And outside what our strategies were, also try engaging with other actors. We were trying to adapt our research as well to things that they can find useful for their own job. For example, we joined an initiative that was called Flatten the Curve, that was present in around Latin America. And what we did, we were connecting best experiences. So the people that were also giving us some time that were researching the initiative, they could also feel they were benefiting by exchanging experiences, and also to adapt in finding some strategic elements that showed in our original design, was the governance of multinational institutions and multi-level. So we did a mapping, trying to understand how they engage and collaborate and share their experiences. So those are incentives that we use either within our consortium, but also with the actors that we're pursuing research with.
Thank you, Matthias. And I'd almost forgotten about the Flatten the Curve movement. It feels so long ago now. But thank you for
Yes.
sharing that. So we're thankfully we've gained our time back, and we can go into one of the other kind of entry points that we wanted to cover in this webinar, which was a little bit about, the research and the research process. And so all your countries were facing the same global crisis, but you responded in ways that were really relevant and unique to your context. And you've been able to demonstrate from the conversation today is how localized these responses were, how important it was to understand the contexts, power relationships, who the key stakeholders were. I'd be keen to hear from you. And Matthias, you started a little bit about this in terms of when you talked about some of the mapping work, but what was it about the research and the research process that allowed you to use it for expedient decision-making, particularly in an environment that was risk-laden, uncertain, and turbulent, like during the COVID pandemic? So maybe this time I can start with Helani about maybe your response to that, and then move around the panel that way.
I'm not sure if this is an answer to the process question, but I suppose the first characteristic that of sort of the research outputs was that it was there, it was fast, and it was available. In a vacuum where people aren't going to the field, using existing data, having staff that are willing to get kicked out of villages because they think it's the health inspectors coming instead of survey people, enabled us to fill a vacuum that really existed around those topics that we were researching on. So I think that was part of, sort of the research process in itself. And yeah, so fast and good enough, as I touched on before, not perfect. I mean, later on in this core cycle, as we did 2-3 rounds of research with the funding, we actually got close to perfection, I would say. That makes, serious statisticians happy. But we got there slowly. We mobilized very quickly with very imperfect, very small sample sizes, 20 people in a district studied using e-diaries and so on. So yeah, I'm not sure what else I could, say. I might come back after I hear some of my other colleagues.
Sure, you're welcome to do that. Anna Carolina, I feel like you're ready with something you want to share. Go for it.
Well, I'm hoping that it helps to answer the question in terms of process that led to not
I think it
outputs
could
that
be
were actionable.
I think it could be process, Anna Carolina, but it could also be the type of research. Like, did this situation kind of lend itself to a different kind of research that was relevant to be able to do it fast, that lend itself to a process that was feasible in a situation like this? So feel free to kind of expand on and not feel limited in the way that you want to respond.
Sure. So I think that to pick up on things that I have said, the process was very much of co-producing and understanding the knowledge. And so with that, I think a fundamental element of it was collectively making sense with our partners on the ground, with the research team, with our researchers that hold a different kind of expertise. And that really enabled us to move rather quickly to respond. But because we had also created this deep listening throughout the process, it was important for whatever it is that we were producing to also bear witness to the workers' lived experience. And I think the connection for me there about process is that workers need to see themselves reflected, their stories reflected, whether it's, the mixed methods process that we used, but it's also so that they also hold ownership of that data and can participate in claims making processes or advocacy processes to further their demands. So I think that is part of the process that I did want to emphasize. What was unique is that I think from the research team at WeGo, we understood that this needed to shift the dynamics. We could still uphold research rigor, but that didn't preclude the researchers from deep listening or producing knowledge, again, with this idea of care, but care as a deliberate and ethical choice. And I think that's something for us to carry forward from the pandemic or from crises. How do we shift some of our orientations so that it is responsive and ethical at the same time? So I think that is something that I just like to share.
Thank you, Anna Carolina. And I'm kind of like highlighting some big important words that are coming out from yours as well as Helani's kind of interventions, is this importance that, collective sense making is important, and for people to kind of feel like there's an ownership to the data. And I hope we can continue to do that post-pandemic, because I do feel like there's always this disconnect between those who collect data and those who use the data. And if you don't see the importance of the role that you're playing in data collection, and if it doesn't reflect your own realities, there isn't even as much attention to the reliability of that data. So that's a really good point you're making. Thank you. And the empathy, you're bringing in a really important aspect in terms of compassion and empathy as we think about research, and that it doesn't need to be this feeling of being involved in something that's clinical in nature, that seems really removed from who we are, but it really is something collective that's important to all of us. And to do this, as you said, to use care as deliberate and an ethical choice. I really hope that we can all kind of carry that with us after this webinar as well. I wonder, Matthias, if I can come to you in terms of your thinking, or if you want to elaborate on things you've already said with respect to the type of research and also the process that allowed this kind of responsive and use and in decisions during the pandemic. Matthias, can you hear me?
Yes, I miss your question. I miss it. My connection is not very good today.
No problem. You are freezing from time to time, so sometimes we're missing what you're saying, but I think we're able to kind of stitch it all together. The question is, would you like to kind of elaborate a little bit more, particularly on what kind of research and research processes allowed this kind of rapid response mechanism by governments or by decision makers that we can learn from and that might be able to take us forward from the experience that you've had and that you shared in the article.
Yes. One of the things that we did in our research agenda is that we understood from the pandemic very quickly that the kind of qualitative research that we were pursuing was going to be really challenging. So very rapidly, our one of our research members is part of the network of mixed methods, very specialized. So with them, we created a discussion on how to pursue in the context of difficult, challenging context that we were working on, and how to organize focus groups and interviews in this context of lack of trust, social distancing, conflictual relationship with governments. So, and we came up with some discussion, that some learnings and suggestions that we systematize and we share with not only with within our consortium, but also with the whole core agenda, the core members. So we've learned that it was going to be different, and we had to adapt the way to approach this in virtual context without creating the fatigue and the distances, where we found that they were very useful, and every single team used them in their own agendas. Something also that we're learning in this design, this kind of design, that it was very useful, the flexibility, but at the same time we've learned that we need to institutionalize that flexibility. Flexibility shouldn't be just let's do it as we face the problems, but it has to be by design or organized in step by step. Now we are playing the role of a knowledge transfer in a new cohort of projects that IDRC is funding, and we took all of those lessons learned in this design. I think that these two elements have been crucial for us.
Super, thank you, Matthias. And Ramos, you get to kind of wrap this up with anything that you feel would add to the conversation based on your experiences, and given that yours was a really interesting approach in through PEP and particularly through modeling of it. And I know that during the pandemic that was quite controversial in terms of whether economic modeling and other kinds of knowledge would be able to help us think about how to respond to what we expect the damage of the crisis would be on people's health and well-being. So your thoughts on the research and the research process and what we can learn from it. Over to you, Ramos.
Yes, thank you. Once we settled on economic modeling, we were clear as a team from the outset that we were going to focus not on the methodologies and outputs, but the entire knowledge process. And that entailed upfront building up these relationships and how the outputs would eventually find their way into the relevant policy space. We're also very aware that policymakers have some concerns around risk-based economic modeling in particular. So we dealt with that, or minimized those concerns, by involving them in the actual analysis. Again, piggybacking on our entry point of long-term investments that we had made. And then we emphasized ongoing interaction and being on the ground, and not just be once-off with the policymakers. So we would have a researcher resident in Zimbabwe on an ongoing process, knocking on their doors, social distancing allowed, interaction, but respecting the social distances. And we exploited that by being on the ground. So we, in terms of process, we emphasize that we're not going to be once off, but continuing to interact with the policymakers, and any concerns or questions they have, we would be dealing with them on an ongoing basis. And one of the tangible outputs of the co-production was that as PEP researchers, we came with 2 policy proposals. But after we involved state officials, we ended up with 11 policy proposals that were taken to cabinet. Meaning that it wasn't just by the way that you are co-producing, but they in fact contributed the bulk of the other 11 considerations. And some of their other suggestions we couldn't take because we tell them that the instrument that we're using wasn't designed for addressing the nature of the question that they wanted to, and would recommend some of our partners that we knew who could address some of the questions that they wanted. So it was very clear to also respect what our instrument could bring and what it couldn't do. And they fully understood that. So those were these salient points in terms of the process that I can think of.
Excellent points, Ramos. Thank you so much. And I think we keep hearing the importance of the sense of co-ownership, which is really important, but also to be realistic about what we can and cannot do through our research endeavors, but always to put citizens at the center of all of this, the everyday human being. And so I'd like to, we're quickly running out of time, so I'm going to put you all to task with one question and ask you to answer in one sentence. So the question is, given what we have learned today, what gives you hope in how knowledge can be used to influence better action impacting the everyday citizen? So maybe I can start with Helani.
2 things give me hope. One is a cohort of think tanks that have improved capacity and a track record across our region, certainly in Sri Lanka, who are better than ever at using evidence and bringing that evidence into policy processes. It really is changing. It's no longer the insiders. It's people who care about, the marginalized who are in this game increasingly. The second thing that gives me hope is, despite all the disinformation campaigns we also saw during this time, we also saw people at home caring about evidence, caring about speaking truth to power, thanks in part to engagement with digital technology. So I think that's also heading in the right direction. Thanks.
That's super powerful. Thank you, Helani. Nice insights there. Matthias. You're muted, Matthias.
For example, what gives me hope is what is happening. What is it's going to be 3 sentences. What is happening right now in our offices? We with the results of our project on collaborative governance, we delivered a training program on collaborative governance, and we brought now as a graduation, the best projects, we brought them to Buenos Aires, and we have 12 decision makers from the region here investing a week with us, using those tools to improve their governance. They're open, they're willing to use information, the findings, and to implement decision making. That makes me hopeful.
That's great, actually. That's a really exciting development. A well-earned 3 sentences.
Thank you.
Ramos, what gives you hope?
Yeah, for me, I would say while the COVID-19 was an excellent example of rapid response, I think the process that we went through is actually applicable to all economic policy issues. And because at the high level, the Zimbabwean policymakers appreciated this this process that we went through. I would say most economic policy issues that usually would require quick and context-embedded responses. And they now have a tool at their disposal in terms of how to be doing that, as opposed to a once-off intervention that dissipates after a few weeks. So that's what gives me hope that we have this cohort now of policy actors and stakeholders in Zimbabwe that went through this co-production economic modeling for Zimbabwe.
Thank you, Ramos. And last but not least, Ana Carolina, what gives you hope?
Thank you. So I think this is a hard act to follow after my 3 panelists, but I think what gives me hope is knowing that research processes can make visible and value local knowledge and particularly solutions. And also the fact that working in interdisciplinary teams really brings a confluence of skills that can better help us tackle complex crises and questions that are put forth in our world today.
Super. Thank you. Thank you, everyone. This has been really fascinating. And I wish we could talk more, but unfortunately, I think we've run out of time. And while there is so much more we can explore, we'll perhaps have to find other opportunities to keep this conversation going. I'd like to just wrap up with a few of my own reflections before I hand over to close this webinar. And I think what I've learned most from this conversation is that while the pandemic surfaced what were already existing social and systemic fractures that caused inequity and vulnerability to persist, it also permitted organizations like those that you shared on this panel, but also all the other stories that we have in the bulletin, and globally that haven't made their way into this particular research project, is that organizations with established social and technical capital were able to really rapidly respond in very meaningful ways to the needs of decision makers. And a lot of that was underpinned by credibility and legitimacy, really important relationships. I don't think we talk enough about social capital relationships, but also the capability to be able to respond rapidly with rigor and trust to enhance the evidence production as well as use. But I think most of all, these stories demonstrate that the interlocking nature of multiple influences on evidence use are social, structural, technical, relational, but of course, political as well. And I hope that these experiences, as well as those of all our listeners, together can help us think about the enablers and the disruptors in the evidence ecosystem. And furthermore, I hope that these lessons that can advance us towards better evidence-informed people and policies and practices. So on that note, I'd like to invite Adrian Di Giovanni, the IDRC team leader for democratic and inclusive governance, to provide us with some closing remarks. And I would also request the editors, James and Andrea, to put your videos back on so we don't forget the important role you've played in all of this. To our panelists, please keep your videos on until we close. Thank you so much, and over to you, Adrian.
Thank you, everyone. I've been given 5 minutes, which I'll try to keep to. So I'm calling in from Ottawa, Canada, and that's the traditional unsurrendered territories of the Algonquin and Anishinaabe Indigenous peoples. We always try to recognize the territories we're on in public events. So I've been asked to give some closing remarks. Largely, it's a thank you and a congratulations. James and Nasreen sent me some questions, though, to go a bit further, and I'll try to keep to those. And really, the first one was, why was CORE an important investment for IDRC? And we've kind of been doing that, jumping back 3.5 years plus. Where were we when the pandemic hit? And in IDRC's case, we were just going into a new year budget-wise, and this once-in-a-lifetime opportunity in terms, or crisis hit, and we thought, well, how can we make sure we're there, fast, and available, to take Helani's words from her remarks, that we knew there was something big here. We'd never lived it. 100 years back, I got stories from my Italian grandmother in the village from the Spanish flu. And so we wanted to respond, and that much we knew. What we didn't know, though, there was a huge amount of uncertainty. Where would the pandemic go? How long would it last? What would the impacts be? What would be the responses? Like, yeah, I'd forgotten flattening the curve. And so we responded with our largest, as IDRC, rapid response was CORE with 20 projects, 42 countries. And now we see the power of this model in terms of 250 publications, 200 stakeholder engagements. We can rattle off the statistics, but it's really the richness of these discussions that we take away from it. And we didn't know where it would go, but we knew a couple of things, which was one, that we probably would have all moved on 3 years on, and in many ways we have. There's a kind of, people get COVID, but it's a bit of like, oh yeah, you got COVID, instead of, oh no, do you have to worry about your life? What about, super spreader events, so forth. Trying to channel my best 2020 here. But then we also knew that, like, here is a chance, not knowing how the pandemic goes, to capture what it means to support large scale research in the face of large problems and emergencies. So we wanted to capture both the, how do you do research, and what can we learn for supporting, hopefully we won't have to, but in the context of future emergencies. And so over and above all the wonderful country level, project level elements that we've heard. And so it was an important moment, and now we begin to see 3-4 years out what the impacts are of a research investment. And we knew that the timing of an emergency and the kind of incubation period of research might not fully align. So the second question then is why IDRC wanted to combine CORE with some critical reflection, learning, a learning journey, a special issue, all the KT that we've mentioned, the knowledge translation elements. And really that's what I've just mentioned, that there was more than just the emergency, but learning about, one, putting the pieces together across the projects. What are the general themes to feed up in terms of findings, but also the reflection on what did we do so we're ready next time. And just a few things. What was important for us, more in the weeds IDRC, one is we were trying to launch a new strategy just as the pandemic was hit. And this idea of being more intentional, reflexive on knowledge translation really came out, was coming as a priority. And we took this as an opportunity to find some of the best, smartest people in the world, like IDS, to really help us already seed our thinking longer term. And we have a lot to say. And IDS and James and team have, in a sense, accompanied IDRC since in thinking about what does knowledge translation support mean for a northern global organization like IDRC, and how do you do it thoughtfully, intentionally? And that really came out of this discussion today. And then one thing that we struggled with at the time, and we still struggle with, and it still comes in, is all these dynamics between how do you go from hyper-local to global? Where do you put that emphasis when you do knowledge sharing? How do you be really responsive to context, but not be at such a micro level that you don't have larger cross-cutting findings for regional or global? We're never going to get the balance right, but early on, that was some of our thinking. And also this push-pull, supply-demand. How do you really ensure that the researchers, research partners drive the efforts while also trying to come in and provide support? And I think IDS was tried to be attuned to that, sensitive. It didn't come organically because it was all flying together at once. COVID and trying to put together knowledge translation support. I think Matthias described a bit more very nicely how they've tried to do it from the ground in. I'm at 5 minutes. I failed, so I'll give just a few key takeaways from IDRC in terms of what we heard today. I mean, this idea of institutional readiness has really stayed with us then and since. What was so successful for CORE is that we had an existing strong network of research partners who could, at a high capacity, but in a very grounded contextual way, respond to a big emergency. And so there was a big amount of trust and flexibility that comes from longstanding relationships. Looking forward, what that really brought out to us is that we had to up our game in other areas of our support. We're the democratic and inclusive governance team. There were very few governance, justice, human rights, think tanks, partners that we could rely on. It. Most of it was economic and kind of social type research. Asuntos del Sur, and I think WIGO are some of the exceptions that get us more into some of our core areas. Since, though, coming out of the pandemic, there's a crisis of democracy, crisis of civic space, crisis of inequalities, all amplified and worsened in different ways by the pandemic, though with some rays of hope. And so really since, and that was even with 6 months, year out, we've tried to incubate stronger research hubs, knowledge network on some core themes that weren't the core themes, on some fundamental, I would say, themes like grassroots justice, human rights. And we continue to do that. And Matthias has mentioned how Asuntos del Sur is now accompanying us on that journey on issues of climate defense and defenders who are facing threats day in, day out. Another thing is that I guess the strategies for engagement and how to influence policy. One thing, in Canada, 20 years ago exactly almost, we had the SARS outbreak, which thankfully was contained and it didn't blow up to a whole pandemic global nature. It could have. We wouldn't have been in the same place with technology then in terms of vaccines and Zoom. But what happened when the pandemic hit is they took out all the reports from the commissions of inquiry that told you how to be ready for the next pandemic, and most of them hadn't been followed. And we kind of knew that then, so we thought at least make sure that we have the documentary evidence to help feed the next emergencies, but then think seriously about process and how do you get in the faces of policymakers, as we'd like to think about how do you shift that. So we don't claim to be able to do that, IDRC or our partners all together on global phenomenon this big, but hopefully we are learning. And I think Kalani, you ended nicely with, even in the face of disinformation, even in the face, there is some hope. And so let's keep thinking about that. And that's where we see the opportunity. And right now, though, the emergencies, we know there's a climate crisis, there's a democracy crisis, there's inequalities, inflation. The emergencies haven't gone away, so we have to keep really pushing our thinking, because most of the findings and conclusions we presented today, we knew. It just got amplified in the pandemic, and so that we don't want reports collecting dust. And so I think I'll end there, and it just, when you can get on top of everything else a bulletin issue, for us that's icing on the cake, because we're thinking very much country level, hyper local, influencing the policymakers the way Ramos described. But we do try to have larger findings, global majority, Southern voices amplifying up. And so thank you and congratulations to all the authors, to all the teams, and a heartfelt thank you to James and team. And James is the person I was in contact with most. We've never met in person. I hope to get to Brighton sometime soon. I could say a lot. The one analogy I always like to fall on are Olympic figure skaters who are Canadian, very near and dear to Canada. They do like logic-defined physical moves, and they make it look easy. It's with grace. They have to smile throughout. That's when you're dealing with true professionals. That's been the experience with James, Poppy, Louise. I haven't met Nasreen quite yet. Everyone else, the larger team. And so really thank you. IDS has been a long-standing, important partner. You continue to be and will be in the future. And so just hopefully we can have a pint together or something to really celebrate at some time soon. I'm 1 minute over. Thank you very much.
Thank you, Adrian. And I don't think there's much more to say. We're at time. Thank you, everyone, for joining us today, for listening in, for accessing the links, read the bulletin, and do find a way to stay in touch if you want to hear more about these stories or share your own experiences. Have a good day, everyone. Goodbye.